Here now.
Great. Super. I see Alva joining us. Welcome, welcome. Welcome, everybody. So great. So let's kick off. My name is Nadine Ferris-France, and I'm the Executive Director of the Irish Global Health Network. And I'm here today co-moderating with my friend and colleague, Morgan. Do you want to introduce yourself?
Hi, yeah, thanks for that, Nadine. I'm Morgan. I've been a member of Women Global Health Ireland since September 2020, I think. And I'm currently working as a health systems researcher in the Royal College of Surgeons of Ireland. And it's just lovely to see you all today. You know, cameras on and cameras off, it's all good, but nice to have you all.
Super. So, topic of women in global health, fabulous. We have an incredible group of women who've been working together for the last, I'd say it's 2 years now. And in fact, when I see Alva joining us, I remember a photograph conferences probably 2 or even 3 years ago, where you're all standing on the stage and Alva was like this, and there was this group of women around you, Alva, and it was like the start. It was like Women in Global Health was born in that moment. So I love that we're back here today. And Women in Global Health, it's a topic that's very close to my own heart. I started my own career working in the World Health Organization on women's health, and then for many years on gender-based violence and sexual reproductive health, and it's very exciting that now now in Ireland that we've joined up with the movement of Women in Global Health, particularly for us as the Irish Global Health Network. It's such an important voice, and we really want to see women's voices and the spaces that we could, should and can take, that we do that. So we're really delighted to be supporting and hosting the Irish chapter of Women in Global Health. And we're really looking forward to the community as it grows. And I guess this meeting is the first of those meetings. It's like a community meeting where we're together. Just on a couple of housekeeping things, we are recording the webinar. We find many people will be watching back and joining us that way. We will be live streaming on our YouTube channel as well. And like any meeting, if you've got any questions, we'd like it to keep the tone informal. We have a number of things set up for today, but if you've got questions or comments, just pop them in the chat, and let's start this community of women in global health the way we intend to continue, so as inclusive as possible. What we're thinking of, what we've kind of outlined for today is we're going to start with an introduction to Women in Global Health Ireland, find out a little bit more about it. We have a wonderful panel discussion where we will hear from some really inspirational speakers from different perspectives. Then we're going to go into breakout rooms just to give us a chance to meet each other a little bit more and to flesh out a little bit more in terms of what we want Women in Global Health to be doing and to be focusing on, and then we'll come back together as a group and talk a little bit about next steps and where we see that happening. So great, Morgan, over to you. You want to try and engage us a little bit?
Yes, so hopefully in a couple of seconds you'll see, oh yeah, on your screens, and you meet your screen. So as Nadine said, yes, we'd like to see this as a community meeting, bringing people together, and to kick that off, we'd just like to ask you a couple of questions. So either on your computer or your phone, if you enter www.menti.com and enter the code 91997093, and we're also going to put it in the chat. So if you click on the chat function at the bottom of your screen, to the right-hand side, you should see the website and also the code that you can enter, again, either on your computer, or you can bring it up on your phone or scan the QR code. And then Joan is kindly going to bring up a question for us. Where are you calling in from? What county, what country? So we've got Dublin, Limerick. And no worries if you haven't been able to join us yet, we're going to keep it up there for a while and still in the chat. Sligo, Italy, oh, lovely. A lot from Dublin. No surprises there, I guess. And if everyone's having any issues, let us know in the chat. We can help you out. Germany, Kenya, an awful lot from Dublin. Sweden. Oh, London. I have family there, so it's close to my heart. We all good? Are we happy to move on to the next one, Joan? Great. So the next one is, what brings you here today? What are your expectations for the meeting? So this can be anything, whatever comes to mind, what you'd like to get from today.
Just look how quick everybody is. Like, you know, us women, it's so quick. We're like in there, you know, boom.
So to learn from others, network with colleagues, network, learn about the strategy, connections, that's a great one. Hopefully we will have a lot of connections today. Oh wow, I could barely keep up with it. Listen, develop the Women Global Health Ireland agenda, learn, to learn from others, make a change, share ideas, find opportunities, strategies coming up again, yeah. So making connections, learning from each other, developing a strategy together for change, drive for gender equality, understand more about Women Global Health Ireland. Hopefully Paula will definitely address that one in the introduction. Social change, see what this is about. It's a good joint working. Yeah, so I think, yeah, summing that up, I think connections, networking, making colleagues, expanding your horizon, learning about the Women Global Health Ireland chapter. Thanks everybody for your answers. They were lovely, and hopefully we'll address as many of those as we can today, and then over the next couple of months and years as we grow our chapter together. So I think now we're going to bring you over to Paula. Nadine, if I have that right. And Paula is one of the co-founders of Women Global Health Ireland, who's going to introduce you to the Women Global Health Ireland chapter and tell you all a little about ourselves.
Absolutely. Thank you, Morgan and Nadine, for a lovely welcome, and so a big warm welcome to everybody. It's wonderful to see so many names, and some familiar, some not. So yeah, just one slide here. I'm just going to give you a very quick overview of Women in Global Health Ireland. I think you're going to learn more about the global network, which we are a spin-off from, if you like, the Women in Global Health Global Network. And we have Mwende as one of our panelists, who's going to be speaking a little bit about the global level. And then we also have Sabine, who is in charge of Women in Global Health Germany, and was one of the first chapters to be set up. So Women in Global Health Ireland, we had the idea, a number of us actually kind of independently, who were either connected to Ireland or in Ireland, had the idea of starting an Irish chapter when some of us were involved in the global network. And I've been part of the global network for a couple of years, about 3 years now. And then very luckily made the connection with the Irish Global Health Network, who'd also been having some discussions. And so somehow by chance, we all got in contact with each other and said, right, well, let's go for it. Let's start up Women in Global Health Ireland. And indeed, it was at that meeting, it was the annual meeting of the Irish Global Health Network a couple of years ago. I think it was at 2019. The years are sort of flying by now, when Alba indeed was presenting a wonderful presentation. And we announced there that we would like to do this. To set this up, and so that was our first sort of pitch at setting up Women Global Health Ireland. So after that, myself and Bryn Gilmore, who I don't think she's on the call, she's on maternity leave. She did say she'd try to join it, but having
I am Paula. Hi, just in the background though.
Hi, lovely. I'm delighted you could make it. Wonderful.
Just listening as much as possible. Sorry to interrupt.
Fantastic. Great to have you on. So we sort of started the getting things in gear to actually establish Women in Global Health Ireland, and we got an MOU signed with the Global Network in April 2020. At that time, we had a core team, which has kind of evolved over time to become a mixture of a core team and an advisory board. And in the meantime, Morgan and Adrian, who you're going to be hearing more of shortly, joined us on the core team with Bryn and myself. And we have an advisory board, which Nadine is part of, and Peggy has just very kindly offered to join us as well, which we're delighted about. And you're going to hear from Peggy in a minute. So we have an advisory board of 5 at the moment, but we are very happy and keen to have more people on that, representing different organisations and groups in Ireland. So that's something we can discuss as well in our breakout groups. We had an informal launch, and of course it all coincided with COVID. So, and in that time, during 2020, the Irish Global Health Network started to run a series of webinars around COVID. And so we co-hosted one together on COVID and gender. And we had Sarah Hillware, who is the Deputy Director of Women in Global Health, speaking at that, along with lots of other really amazing women. And that was our informal. Thank you. Yeah, somebody else is sneezing in the background, I think. Can you hear me all right? Yeah, great. So we had that informal launch, and then we got the MOU signed. We set up our Twitter account, our website page, which is hosted again by Global Health Network, and our own email. We join regular meetings. So there's a monthly global meeting, which one of us always joins. And then there's usually a monthly or 6-weekly European chapters meeting, which we also join. And there are annual chapter retreats. So we're quite busy dealing with the global network, the European network. And, you know, we want to align, of course, Ireland's chapter with those networks. But also make it specific to Ireland and the context in Ireland. So we're really looking at this as an opportunity to reach out to Irish organisations, Irish women and men working for gender equality in Ireland, and particularly in health, but also generally gender equality. So then we also developed, between the lot of us, we pulled together a group of stakeholders, and we did a stakeholder mapping exercise. We sent out a survey a couple of months ago and did a needs assessment. And this is the next step, where we've taken the findings from that survey, which is going to be presented to you shortly. And now we're sort of developing our strategy for the next sort of 18 months or so. So we're looking to the end of next year as a starting point. And we really wanted to make this as open and inclusive as possible, as Nadine has said. So to hear all your voices. I'm not actually based in Ireland. I work in global health, but I'm based in Jordan. I'm currently in Italy. That's where Italy came from, but I am based in Jordan, but only because my husband happens to be working there. So I work from home, and I haven't worked or lived in Ireland for a long time, but I've always wanted to connect back with Ireland. So this is such a great opportunity to be part of that global network, but also link up with all our Irish colleagues. So over to Nadine. Is it back to you again? Yeah.
Thank you, Paula. What a wonderful way to connect back to Ireland by facilitating and being involved in this wonderful movement. So brilliant. Thank you for all the work that you guys have done so far. So we are going to kick off, and I'm going to invite the panelists, a couple of panelists, to join us. And we're really honored and delighted to have such a wonderful group of speakers. So we have Peggy Maguire. She's a political scientist. She's worked at the EU and national level for over 20 years. And she's constantly highlighted the need for gender equity in biomedical public health and social policy. And she's currently Director General of the European Institute of Women's Health, EIWH. We have to get our heads around all the new acronyms that we will learn today. So you're very welcome, Peggy. Delighted you're with us. We're joined then by Alana Ryan, and Alana leads the health policy and advocacy work of the National Women's Council of Ireland, including their work on reproductive rights. She's got a strong interest in social determinants of health inequalities and the impact that early adversity can have on health across the life course. So welcome, Alana. Delighted you could join us today. We're moving over to Mwende, Stephanie Muya, who is in Kenya. And she's saying that it's 18 degrees in Kenya and that it's cold. So she is Chapter Development Manager for Women in Global Health Global. She's a beautiful young feminist and a lawyer with a legal background with 7 years experience in women's rights and advocacy, in partner coordination and organizing for change, among many other things. So you're so welcome, Mwende. And then last but not least, we're joined also by Sabine Ludwig, who I think Paula mentioned earlier, or Morgan mentioned earlier. She's the head of Women Health Women Health in Germany, and also the EU. She's part of the EU chapter's executive board. She works as a guest professor for public health and health services research at the University of Applied Health Sciences in Bochum in Germany, where she teaches on global health and many other topics. So you are welcome. What a panel. I'm delighted to hear your voices this morning. And if we can, Peggy, I'd love to start with you and to hear a little bit more about the work that you're doing, a little bit of the overview of some of the strategic priorities of the European Institute of Women's Health. And I know you're such a strong advocate. So over to you, Peggy. Oop, you're muted. You're nearly there. Yes, nope, still muted.
I always forget this. Sorry.
I know. You're welcome, Peggy.
Thank you very much. Thank you, Nadine. Thank you, Paul and Morgan and the Women's in Global Health in Ireland for inviting me to be part of this very exciting meeting. Just as Nadine just tell you a bit about the Institute, we're 25 years old this year, and our main objective is to promote gender equity in health. And we do this through our evidence-based promoting biomedical and social economic research to ensure that women get access to prevention, treatment and care that's appropriate for them. And we've been doing this for quite a long time, and we try to do it at multi-level, working with the Commission in advisory roles, with the Parliament, with the WHO. We have worked with WHO on gender equity for quite a long time now, and contributed to their Women's Health Strategy for Europe. And today we just completed and submitted our report to the WHO EMRO region, which is the European Mediterranean region of the WHO. We've just produced the first gender and health report for them, which made me also realise over the last couple of months the importance of global women's health, and to look at it from that perspective as well, that so much more needs to be done. So the reason why we're all, I suppose, active in this area is that sex and gender inequities in health are evident across the lifespan from birth to old age, and it really is an unfinished agenda with large gaps and unmet needs, and they're still persisting regardless of all the legislation and the directives, etc., over the last number of years. It's not, sex and gender are not systematically integrated into policy, into programs, education, training or research. And really, this is what we've all trying to address over the last number of years. And even existing policies and legislation aren't fully enforced. And we're talking about the pay gap, the pay legislation, work-life balance, clinical trials legislation, all of these now have to be looked at from an implementation perspective. But if we're looking at women's health, we have to look at it from two perspectives, and that are the biological and also the social dimension as well. The biological sex differences between females and males are relevant for the diagnosis, the treatment, and the progression of various diseases and medical conditions. Women have higher rates of diseases such as breast cancer, osteoporosis, autoimmune diseases such as multiple sclerosis, more than men. And other diseases affect women and men differently, and they don't always get the appropriate treatment and are underdiagnosed, particularly in diseases such as heart disease, which is, I think, is a well-known one from research. Women are also the heaviest users of medicines, but they still remain underrepresented in clinical trials, and just so research and data are weak for women. There is not a robust evidence base for women from clinical trials. And from the social dimension, most of the factors that influence health lie outside the health sector. So we have to be very, very mindful when we're looking at women's health that we have to take cognizance of not just biological, but also the social dimensions as well, because inequality is experienced in earlier life in access to education, employment and healthcare, as well as those based on gender and cultural background, can have a critical bearing on the health status of people throughout their lives. And also the combination of poverty with other intersectional vulnerabilities such as childhood, old age, being part of a minority background, LGBTI, and ill health can lead to poverty and or social exclusion. So when we're looking at over the years, women are generally underrepresented in clinical trials. This is historic, and women make up the largest proportion of the older population, are as I said before, the heaviest users of medicines. So women and older people have been excluded from clinical trials for various reasons. Yet women have a greater risk of developing adverse drug reactions compared to men. And the new clinical trials regulation, which we're very happy about and worked on and lobbying for since 2014, that new clinical trials regulation, which is due to be implemented this year, is a huge sort of game changer for women, because from now on, unless it's a good reason, women and older people have to be included in clinical trials. And this is a safety issue as well in relation to medicines, because medicines are safer if the population group for which drugs are researched and going to be applied to are included in the trial itself. So, I mean, from the Institute's perspective, we feel that we need a holistic approach to women's health and well-being, which must incorporate both the biological and the social, economic and political influence as well. And I know Sabine and Alana will be speaking more about them. And as a result, sex and gender considerations must be integrated across all policies. It must be an all policy, all government approach, because all policies influence health, including housing, education, transport, technology, etc. So it must be an all government approach. But one of the issues that we're continuing to work on, even though women are now will be included in clinical trials, we have to make sure that any data that comes out of any research is disaggregated by age, sex and gender. Because if not, we cannot target proper policies, either in the research area for biological area, or even in the social area as well. So we really need to influence this aggregation of sex and gender.
Just
and
1
age.
minute left, Peggy. Thank you.
All right, thank you very much. So, I mean, as we know, the coronavirus has had a huge impact on women's health and has exacerbated any inequalities that are there already. And really the response hasn't always been adequate. Women haven't been involved in the decision making of the responses. And this is a huge issue moving forward now. I mean, the responses to the pandemic, including isolation, have had implications for mental health and other issues of domestic violence. An estimated 9.8 million globally may encounter family planning access issues as a result of the coronavirus disruptions. And the United Nations reported a surge in domestic violence, particularly affecting women and children because of international lockdowns. So the thing that fascinates me is about the whole issue of women's health is it's 25 years since Beijing. We're now into 5 years, maybe into 6 of the UN Social Development Goals, and yet large sex and gender inequities continue to persist and are in danger of being heightened. So really, we're looking at policies now that look at gender mainstreaming and gender budgeting moving forward and have gender impact assessment in all policies. We need really strong leadership at all levels, political, economic and social, if we are to create any change whatsoever in women's health. And just to conclude, policymakers have to listen and engage women in expressing their unmet needs, and also across the life course, their experiences, good and bad, of health systems. Investment in women-centred policy and decision-making and delivering on these with the involvement of women themselves is a defining factor for success. So that's how I'd like to end. I mean, we definitely have a huge job still to do, and we really need to work all together. And particularly having done and completed the WHO report in the EMERA region, you just realise how really women globally, nationally and regionally need to be addressed in the context of where they're living and how we approach that together moving forward. Thank you very, very much.
Peggy, thank you very much. What an incredible overview. That was just fantastic. You've really set the scene for us. And even just there's so many different issues that you're describing. It just starts to show the breadth and the challenge in a way, and the opportunity in focusing specifically on women in global health. So Peggy, that's wonderful. We're going to come back to you. And I know for everybody listening, whoever was part of the meeting, please do put your comments and your questions into the chat. I see from Breda there, women make up roughly 70% of the global health workforce, but hold only 25% of senior roles. Really, really significant. Alana, coming to you, please. You're going to bring us from Europe back to Ireland, and just tell us a little bit more about what's some of the work and the priorities that the National Women's Council of Ireland are doing.
Yeah, thank you so much for having me here today, Nadine, and also to Peggy for such a tremendous overview of what is a really complex topic, and one which we're all familiar with, but ultimately there's a lot more to kind of probe and interrogate. And I think Peggy raised some really critical issues and points to consider. So it was a great intro and I really appreciated it. I suppose coming back to Ireland and the National Women's Council, I've been in post for only about 4 months. Before that, I spent most of my career in England, working in London. And I think that the global perspectives and learning in a kind of a comparative lens around what's working in different systems and approaches which have been mainstreamed in other countries, particularly EU, OECD, that's extremely helpful for us in how we develop and agitate for better health experiences and outcomes for women in Ireland. So it's really good to be here today and to be able to have that shared knowledge and community sense from yourselves. So a big thank you for inviting me. But It's an exciting time for the National Women's Council. We've just launched a new strategic plan, and the focus of that is no woman left behind. So within health, we're talking about ensuring a positive transformation in women's health, but there's also ancillary goals there around women in leadership. And I've seen the points raised in the chat around women being concentrated in lower paid, more precarious roles in our workforce, and how can we ensure that there is that progression and that development and leadership capacity for women who are giving so much of their time to the health and social care professions. There's also a goal around developing universal public services, and obviously the health service and having access to universal public childcare are really fundamental aspects of our work over the next few years. So I think our job in the health team in the National Women's Council is really trying to highlight the additional work that needs to be done around the health system and to ensure that women, to mitigate risk trajectories that women do need, support for adverse health conditions, because there's a lot more we can do in the preventative space, but also to recognise that there are barriers to accessing healthcare in hospitals and acute settings because of these ancillary issues around childcare and family supports and all of that piece. So I think at the National Women's Council, building on what Peggy has said, our focus is really on inequalities between groups of women and trying to work to ensure that groups of women who've been historically marginalised and disenfranchised in health policy work are given voice and representation, and that we really listen and ground our positions in their concerns. And so at the moment, we sit as the critical friend to the Department of Health Women's Health Taskforce, which Peggy is also on. And our role there is really to think about what can we do to ensure that all women in all our diversity are seeing the change that we need to enable us to live our lives to, our full potential. And part of that is doing radical listening workshops with groups of marginalised women to understand their needs and the barriers that they are experiencing and how they may differ from kind of the woman who policy has historically spoken to, which is often a white middle class woman, rather than thinking intersectionally around, multiple and overlapping barriers. So we're really trying to kind of build that understanding into our work, and it's coming through as well in our abortion work, which has been a real focus since joining, because this is the third year since the legislation was passed. And obviously, while there has been significant progress, and Alva is far better qualified than I am to speak to this, but we really know from looking at the data and listening to women and pregnant people that there's a huge amount still to be done. And it's particularly those women on the margins that are suffering from a lack of a kind of a more thoughtful and expansive access points. I think there are particular barriers around PPS numbers. There's issues around accessing care within the 12-week window. There are points around poor geographical coverage and how that disproportionately impacts women in rural locations or women in direct provision centres where they can be very isolated from providers. These are all issues which have come up since the rollout of the Termination of Pregnancy Act. And I think as the National Women's Council, working in partnership with others in the abortion working group, we're really taking this as a critical opportunity to push for further reform to ensure that the legislation and its operation on the ground is meeting the needs of every woman and pregnant person. And so that really is a kind of a key focus for 2021, because this is our unique opportunity, because we are moving into that public review. So I suppose for us this year, the first year of the new strategy, still getting to grips with it, but it really is kind of grasping the opportunity of the review of the abortion legislation and simultaneously working with the Department of Health on the long-term strategy for women's health and really trying to bring that intersectional perspective to that. So it'll be great to hear some thoughts from others on the call, and I'll just wrap up there. Thanks.
Wonderful, Alana. Thank you so much. Really interesting to hear all the work that you're doing and the priorities this year, and just where we've come in over the last 3 years, and what still needs to be done. So I look forward to the discussion when the panelists are finished. We'd love to hear from as many people as possible on that. Thank you for that, Alana. We're going to move now from Ireland to Kenya to Mwende, and she is going to give us an overview of Women in Global Health Global. So why did it start? What were the aims? What are the different areas of work? And also, Mwende, we'd love to hear a little bit about your own work and your interest in gender equity. So over to you, Mwende.
All right, thank you, Nadine. So Women in Global Health is an organization that has been built on a global movement with the largest network of women and allies that are working together to challenge power and privilege so that we can achieve gender equity in health. It was formed by 4 early career women in medicine who met actually on Twitter, and they asked themselves, why is it that there are so many incredible and well-qualified women in global health, but very few are represented in decision-making roles, whether at global and at local levels. So then after that, they formed the organization in 2015. And right now, Women in Global Health has grown to have over 50,000 supporters across 90 countries. And we now have 25 official chapters and 37 country chapters in the pipeline. We have strong presence in low and middle income countries. And the main focus is on women's leadership in health, investing in the health workforce, gender transformative health systems, and also making sure that we are supporting strong women's movements. So Women in Global Health chapters are really a space for women leaders that are working in health to exercise their leadership at individual level, but also collectively, so that they can mobilize, advocate, gather commitments, and hold leaders accountable towards decisions and policies that are definitely upholding gender equity in health. I co-organized My Dress, My Choice, a movement in Kenya that pushed for inclusion of public stripping of women as an offense under the Security Act in Kenya. And I think being part of that movement, I know very well that when people come together to collectively organize for change, and when like-minded people act together, there's a lot of change that we can be able to implement for our communities, for ourselves, and for the general populations. Aside from the work that Women in Global Health does with chapters, I also want to highlight 2 other initiatives that we have. One, we co-chair the Gender Equity Hub with World Health Organization. And for those who may not know, we actually signed an official MOU with World Health Organization on International Women's Day this year. So then the Gender Equity Hub is a thematic hub in the Global Health Workforce Network. And the purpose of the hub is to accelerate large-scale gender transformative progress to address gender equities and biases in the health and social workforce for the SDGs. Membership is actually open to anyone. So if anyone who's on this call or part of this event is interested in joining the Gender Equity Hub, please feel free to reach to Paula, Morgan, or any of the chapter leaders, or directly to myself in case you do have my contacts, and I'll make sure that I link you up with the team that manages the hub. The other thing that we are currently implementing right now is the Gender Equal Health and Care Workforce Initiative, which we are implementing in partnership with the government of France and World Health Organization. And the pillars of this initiative focus on: 1, increasing the proportion of women in health and care leadership roles. So we want to see more women leading, because I think we've already heard from the speakers before. I think Peggy also mentioned that, you know, women make up at least 70% of the health workforce, and they're really represented in leadership roles and in decision-making spaces. So one of the pillars of this initiative is addressing that, or pushing for more women to be represented in leadership. The other thing that we are very interested in is recognizing the value of unpaid health and care work and the importance of equal pay in the health and social care sectors. And also, we wish to ensure that we are protecting women in health and care against sexual harassment and violence at work. The last pillar of this initiative is focused on ensuring safe and decent working conditions for all health workers everywhere, and of course, women being the core of this focus. So that's just like a bit of the work that Women in Global Health does. And we are really looking forward to seeing more of you participate in the work that we do, and just seeing Women in Global Health Ireland really work together to challenge, status quo and push for more activities, more policies, and just more recognition for the role that women are playing in the health and care workforce.
Mwende, thank you so much. So interesting, and we're really glad to have you with us as Women in Global Health Ireland starts to focus. And I don't know about everybody else on the call, but I'm getting more and more excited as the speakers speak, just about being together in this space. So thank you, Mwende. I know there's going to be questions for you when we open the floor. So just coming over to you, Sabine. Last but by no means least, love to hear from you an overview of Women in Global Health in Germany, and also some more about the EU chapters. Why did you start that? What were the aims? Again, the different areas of work, and of course your own interest. I think it's the reason we're all here is we all have a story about our own interest and what brought us into this space. So over to you, Sabine.
Thank you, Nadine, and thank you to Paula as well for the invitation to speak here. And thanks to Mwende to already giving this broad perspective. Actually, the German chapter was the first chapter of Women in Global Health at all. And we started in 2017. And what Mwende described, maybe you know Professor Kickbusch. She is German. She had quite senior positions also at the WHO. And she was actually asked in 2017 by Dr. Tedros, Ms. Kickbusch, please give me names of qualified women. And then they said, okay, we are going to have this Twitter campaign. And so Alana and Rupa and the other ladies that Mwende mentioned started the Twitter campaign to really give women this visibility. And then the idea was born, actually, we should have like local networks. That means national, like just giving the women working in global health in their countries kind of visibility as well. So we started in 2017 with a core group of about 20 women, so pretty much the same as you now in Ireland. And then we kind of proceeded with a snowball system. So each of the 20 women proposed 3 or 4 other names. So the network actually slowly grew. And now we are about 230 women of different sectors working in global health, like from academia, from the ministries, NGOs, etc., etc. And our main results or achievements, so normally every 1 or 2 years, we kind of publish a list, like a booklet of women working in global health in Germany, and German women working actually abroad in global health, and really giving them visibility. And this booklet and the information about the women we try to distribute actually to different stakeholders. And if we follow now the careers of the women being in the booklet over the last 2-3 years, it's really quite amazing. A lot of them have quite senior positions now, or got proposed for quite senior positions also due to this work. And further activities, now we are working on a mentorship program to also promote younger people in order to help them, to pursue their career. We have published a couple of position papers, one on women in the health professions, like a very important subject right now, also due to COVID-19. We have published a statement on COVID-19 and women, focused also, on the German kind of environment, I would say. And we have hosted an event in the framework of the EU presidency, like the German EU presidency, focusing on the importance of women leadership in the health care sector. And furthermore, we had events on digitalization and opportunities for women working in global health. And then it was about in 2018 already that we had like a Swedish chapter and a Norwegian chapter at this time. And the Finnish chapter was just to be born. So we said, actually, it would be good to have like a European chapters board or something. And then we started to meet regularly, and then it formed like to be a European chapters, Women in Global Health European chapters executive board. And now we try to have calls every 4 weeks in order to exchange our experiences and ideas. And I think it's really a great opportunity for all of us to learn about each other. And right now we are working on a common strategy, all the European chapters. So we have a vision. We want to have achieve gender equality until 2013 in Europe and of course worldwide. We want to have gender transformative policies in Europe, and we want to integrate a gender perspective into the European Health Union. And we try to have like an event with the European Forum of Health Gastein. I don't know if you know about this. And so we promote for gender in universal health coverage, health for the health workforce, gender equality in the health workforce, and in decision making and leadership, that we get more women in leadership positions. And then gender, of course, in the collection of data and in health systems, as well as the health of migrant and refugee women. And what Peggy Maguire kind of pointed out, the importance of sex and gender differences in the diagnosis, prevention, and treatment of this. So that's where we are at on the European level, and we try to cooperate very closely with WHO Euro also to align this strategy with them in order to achieve more and more chapters in other European countries, especially all Eastern European countries. Because now, and then I conclude, now we actually have a Finnish chapter, Swedish chapter, Norwegian chapter, Portuguese chapter, Irish and UK chapter. And, it would be nice to have even more chapters in Europe. The French chapter is going to be formed. I think also the Spanish one, if I remember right, Mwende. And so it would be great to move on this level, and I wish you all the best with your chapter. And of course, we can continue to exchange our ideas and support each other during our calls and support the formation of your chapter. Thank you.
Wow, Sabine, thank you so much. We're so glad you've got so much experience to share. You've got so many practical suggestions for ideas and projects around mentoring and just all around supporting women in global health, and really, really interesting for all of us. So I'd love to just open the floor to everybody. If we can bring everybody back, we purposely have a meeting format so that we can all be in the room together. So just inviting everybody, if you feel able, just to turn your cameras on to give us a chance to connect as women. I think it's lovely to step into something we're very good at, which is connecting with each other. And in my experience, the video helps. Wonderful to see everybody. So the floor is open. Anybody welcome to just jump in. Any questions, any comments, anything you want to add to what you've heard, anything you've been involved in. The floor is open. You can kind of maybe just wave like that or put up your hand. Mary, go ahead. I think I saw you wave, or you were just doing that. Anybody want to come in there? Otherwise, I know so many of you, I'll start to pick names, you know I will. Alva, I can't resist. You happen to be right here in my screen. So that's, if we can, Alva, and then I'm going to go to Bridget. Alva, just to hear a little bit more, if you could add to what you heard from Alana there in terms of our priorities this year in Ireland on abortion or anything else.
I hope you can hear me all right. I'm on my phone.
Welcome.
And it's really lovely to be able to participate in at least part of the webinar today. I think that it's so important that we should actually be looking at obviously what, not just what's happening elsewhere, but actually how we can be actively participating and contributing and developing, and in the reasons why we came here today. I was stuck for a moment, and then I thought the 60 million reasons, and one of them is that sense of staying connected. And I do think that that's something which has in a way, become all the more important and all the more pronounced in this pandemic world. And it's not post-pandemic for so very many people. And my particular interest is in seeing how reproductive rights are faring in this pandemic and what will be a post-pandemic world. And we know that it's been very, very difficult for women and pregnant people in very many countries. And we have seen some of those impacts here in Ireland, where women who didn't fit the rather restrictive conditions for accessing abortion here in Ireland were still travelling to the UK, where these are difficult and for many people dangerous times to be risky times to be travelling, all the more so if you have other anxieties and so on and so forth. So I think it's really important that we actually keep fighting, as Alana said so incredibly well, that we keep fighting to expand the kinds of regulatory situations that we have for access to abortion in particular in Ireland, but also around the world. And my own view, as I've said very many times, is that reproductive health care, whether that's whatever that is, at whatever part of that spectrum, should not need to be and should not be regulated by law. It should be fully integrated into our normal, ordinary, everyday standard healthcare systems. And for myself, I would like to see that happening here in this country, and we'll go on lobbying and working and campaigning for that to happen around the world as well. I'm really looking forward now to the rest of the discussion.
Great, Alva, thank you so much. And wonderful that we have this group here who I'm sure will be just joining together with the snowball, I think I heard you say there earlier as well, and just again, getting together as a community behind some of these aims, really important. And Bridget, I saw your hand there.
Yeah, hi. Really nice to be here, really exciting. So my name is Bridget Frayne. I actually just arrived back in Ireland last Saturday. I'm on quarantine. I've been in Malawi for the last 4 years and was an active participant in the Malawi Women in Global Health platform, which just started just over a year ago, and started with really just four women and grew to over 300 participants within 12 months. And was just, even in a complete lockdown world, was an amazing platform, predominantly across WhatsApp, as well as some webinars, but just for women to connect, share experiences, lots of amazing educational, professional opportunities, lots of opportunities for networking and collaborations that came out of it. So yeah, really nice to see this up and running. And I think lots of opportunity to link with other chapters, as you say, in different parts of the world, to get those perspectives on these issues as well. So yeah, just wanted to share that and say, I think there's lots of opportunity for cross-chapter collaboration internationally as well.
Wonderful, Bridget. Thank you so much. I love that, the link between Malawi. It's like wherever we go, we're just starting to see women in global health, and then the connection back to Ireland. Anybody else like to come in there? We'd really love to hear from you. You can raise your hand with the function if your camera isn't on, or just wave. And I'd love to hear, your thoughts on leadership, your thoughts on some of the things you've heard around mentoring programs, even just the situation in Ireland. How is it in relation to women in global health here in Ireland? Here we have a group of women in global health professionals here. I'd love to hear from you. How about Jane Ann? I'd love to hear from you, if you don't mind just coming in, anything at all in terms of what you've heard, or your perspective from MSF and the HSC, and then your own work overseas.
Yeah, so thanks, Nadine. For those who don't know me, I've worked with MSF for the last number of years, and I'm currently working with the HSC on developing their global health strategy and the memorandum of understanding with Irish Aid as well. So it's very interesting just to hear some of the remarks so far, because it's very much about how we can align what is happening here in Ireland and the priorities and the work that we're doing here with some of the low-income countries that Irish Aid partner with, but indeed also that the Global Health Programme is involved with. And I think a key element of the programme is around, is very much around partnership and solidarity and kind of a reciprocal exchange. And I think that's fundamental also to kind of, I think, going forward in the new strategy as well. So I think we'll be looking to see how we can really, I suppose, link groups such as this and such initiatives that you, that many of you have mentioned already, and trying to see how we can kind of encourage that that exchange really, and that learning in many of the places where we already are working as well. So, but yeah, it's very interesting just to hear, because I think so far I've heard quite a lot, I suppose, from internally within the HSE on the different perspectives around global health, and for many of the public health specialists and doctors that have been involved, but less so from perhaps the kind of civil society organizations such as yourselves that are also engaged. So it's really interesting to hear your perspective.
Thank you, Jane-Ann, and perfect timing. Breda, I see your hand up. So just talking about civil society organizations, we'd love to hear from you, Breda. And maybe just introduce yourself in case anyone doesn't know who you are.
Okay,
I'm
yeah.
sure they do.
Hello, everyone. I'm the Global Health and HIV Advisor with Concern. I'm a nurse midwife, Mater Coomb. And when I signed up for this meeting, I was wondering, is there a draft strategy documented that we're to feed back on, or is this meeting to develop a draft strategy? Sorry if I've lost track. I'm just dealing with so many COVID policy strategies, vaccination program outreach. And my interest certainly is hearing the voices and supporting the underpaid frontline essential health workers. Majority are women in terms of community health workers, midwives, community nurses, the vaccination outreach program. Now we receive grants to roll out in Liberia, where is it, Sierra Leone and Malawi, and to raise their voices and issues so that they get recognized and not displaced. Already I'm hearing some people want the COVID-19 vaccination program in Africa and Asia to be rolled out in a parallel approach. I'm saying no way. Under the routine EPI program we've all worked on for 20, 30 years, the routine vaccinators, upskill them for sustainability and their confidence ongoing. But often they're not connected very well to smartphones, internet, language issues. Obviously, I learned the language everywhere to work with traditional midwives in Sudan and Cambodia, especially Mozambique, likewise. I feel they're outside, even though without them, essential health services are not being provided. And I was talking to my colleagues this morning in Sudan and in Liberia, and because the unfortunate upsurge of COVID in the urban areas in both those countries, delivery of services is down as health workers are under not house arrest, what's the word, lockdown, but also people don't want to go for the services. People are trying to get somebody to collect their antiretroviral medications. They don't want to go to the services for safer delivery. And we're seeing increased morbidity and mortality. I think we'll only know the data at the end of this year in terms of the downstream impacts of COVID-19. So if we can bring that into the half documented strategy or whatever exists, please let me know. Thanks.
Thank you, Breda. Very well heard. And I think actually a perfect segue, as I think we're literally about to move into a section where we're going to present the results of the survey that we've done so far, and then into smaller breakout rooms so we can continue this discussion with our panelists. I just see one more hand before we go in. Dorcas, we'd love to hear from you briefly if you can, and then we'll keep moving for more conversation. Over to you.
Thank you very much, Nadine. Dorcas Guasa, tuning in from London. I'm Zimbabwean, a nurse by background, public health. Thank you for this important discussion. I tuned in because I love Ireland. I think there are some real common historical similarities in our history. And I speak here of the sub-Saharan Africa, where I come from. I think there's a missing discussion, and I'm part of the community in the UK and Rupa and everywhere else I am. I think there's a missing discussion here about the role of the diaspora. And Ireland will know very well what that means, because there is a history here of travel. Look at Paula speaking from the Middle East. But I think that we're not acknowledging the contribution that women bring to this context. We come from Africa and work in these institutions. We work our socks off. We send money back home. The economies are leveraged on remittances that we send home, entirely leveraged on that. While we keep the NHS afloat, we're also keeping the home context afloat. And I think this is not being picked up. Why is it not being picked up? Is it because women are mainly working in these contexts? So I would love to hear a discussion in the entire community around us, around how do we really acknowledge some of the contributions and where they're coming from. The innovation that NHS leverages on today and protects with its blood is leveraged on the hands of the Windrush generation, the Irish nurses and doctors who came back at the time. So there's a history here which I would love to really tap into at another time. And I think for me, Ireland remains interesting because of that connection. So thank you for this discussion. And I look forward to maintaining contacts with the community.
Thank you, Dorcas, and thanks for sharing that perspective. I think it's really good for us to be thinking about the diaspora and where the contributions are coming from, and also to remember the connections we have. It's brilliant that you can join us from the UK today. So let's keep that in our mind as we go into our smaller breakout rooms. Morgan, I'm going to hand over to you there for the survey.
Yeah, well, actually, I'm going to be handing over from you to Adrienne, who is going to be presenting the results of our membership survey that was sent out, I think April, May. And Adrienne is one of our colleagues from the Global Health Ireland, who's going to take you through the results.
Hello, everyone. So we'll just briefly go through the results from the survey here. So let me just share here. So we'll start with demographics, of course. So we had 42 respondents. We were pretty happy with that number, I'd say. And so distribution of ages, we were pretty happy with how, with the age range that we got. Not surprisingly, the majority were female and white Irish. And also not surprisingly, half were Dublin or Dublin area. So we had 88% that identified as employed, and then the 10% that said they were unemployed also answered that they were either nearing retirement or retired. So we had 2% students. And I think, Morgan, you can correct me if I'm wrong, but I think we expected more students than that actually, did we not? Yeah. So further demographics, so primary discipline of work or study. So mostly, not surprising, we saw a lot of public and global health, medicine, international development. The sort of other disciplines that we saw, nursing and midwifery, of course, and then some environmental, social, biomedical, and clinical related disciplines. So primary division of work or study, very similar questions, but saw mostly technical and research and program management, with then some clinical provision or development, IT, HR, gender studies, that sort of thing. So the personal experience questions, we looked at barriers or facilitators to achieving your career and or life goals relating specifically to your gender. So we got a lot of people who used this opportunity to discuss barriers, of course, that was not surprising. Some discussed both, very few discussed only facilitators. Again, not very surprising. So really what we saw was the systemic and unconscious bias perpetuating some of the systems. So burden of gendered tasks like teaching and admin that weren't rewarded in the workplace, women perceived as seen as less than their male colleagues. So, you know, some of the quotes there you can read, so self-limiting beliefs, exploitation in early career, that kind of a thing. Care responsibilities, of course, so maternity and paternity leave, coupled with the either unavailable or expensive childcare, and then the expectation of domestic obligation, which again, we're all familiar with, I'm quite sure. And then there was some things regarding specifically age, nationality, and gender. So again, as Dorcas sort of highlighted there, the unavailability of certain employment opportunities for immigrants, ethnic minorities, making things difficult, doors being closed, and then being dismissed due to age or gender. And then, of course, sexual harassment in the workplace. The facilitators that we saw generally, as Nadine highlighted, we're very good at making connections with one another. And so the facilitators really revolved around relationships and family support, supportive mentors, professional development being prioritized within the workplace. So those were the facilitators that we saw. So the key issues that need to be addressed within your discipline specifically. So the big one was the balancing life and career goals there, followed by leadership opportunities. And I think both of those have been highlighted already through the panelists as well. And then workplace policies and the gender pay gap. So then we looked at what could Women in Global Health Ireland specifically offer that would benefit the people who are answering. So events and networking was a big one. And I know that in the breakout rooms, we're going to talk a little bit more about some of these things. So events and networking, training and resources and mentorship and sponsorship sort of tied there. And then interest groups, things like journal clubs, informal meetups, things like that. So I flew through that really, but those were the highlights. Morgan, I'm not sure if you want to add anything there, but those are really the highlights of the survey responses that we got.
Yeah, maybe just to answer Breda's question earlier, do we have a draft strategy? Short answer is no. So we're all kind of doing this in our volunteering time, on weekends and evenings, as everybody is, working full-time jobs and all the rest. So we kind of, we wanted to just get the inputs from various members and people, and that's the purpose of this meeting as well. And then we will put something on paper, I promise. And it's going to be very, very short, but we will do something on paper, and we'll be able to send that around also to other people who haven't been able to join this meeting, so that anybody can comment on it. And also, we'll keep developing it as the years go on, and hopefully our network grows. So just that's clear.
Thanks, Paula.
Yeah, perfect. So yeah, nothing to add either. But as Paula said, the function of this is to have a chat about, a little bit more in depth about what we've just presented, what you'd like to see us do. So now Joan is kindly.
Welcome back. We probably have one group back. Welcome back. So who's back? Alana's here. Adrienne, you're back. Good. Okay, everybody else will join us very soon. Here we go. Excellent. Everybody's back. Welcome back, as if by magic.
Oh, yeah.
Wonderful. So Morgan, over to you for any what are the kind of main highlights of your group, and understand that we didn't have that long to talk, but what was the conversation?
So I have from Megan, who is taking some fantastic notes from us. So I'm just going to read out your notes, Megan, if that's okay. So we had a lot with bringing health economics into the discussion, research excellence, women global health being part of a research narrative that pushes, I suppose, globally linked, collaborative, cooperation, not competitive research, and our priorities, technology making the world smaller, and on that Breda added, linking the local with global. So we have technology that's opened up a lot for people at the global level, but we don't want people at the local level behind. Feminist transformative leadership, so that what I've just said earlier, cooperative leadership, not competitive leadership. We had ideas for collaboration. Claire brought up the Women in Economics Forum in Ireland, which then linked with what Peggy said later, which is looking at what leadership areas, looking at the Women's Health Taskforce as a model. If I've got this right, Peggy, what areas of leadership in Ireland are women missing from leadership areas, and especially the economic areas, and then workplace policies, having supportive workplace policies that support women in the workplace. And definitely even workplace policies in humanitarian settings, like what we're seeing with the COVID-19 situation. Are women who are generally frontline workers, especially community health workers, are they supported, and what do they need to not be left behind. So Paula and people that were in my breakout room, definitely add to that if I've missed anything.
Yeah, just you captured it all really well, and I think I loved some of the expressions that came out of it. And Dorcas, be bold.
Yes.
And, as we come out of COVID, let's really look for a transformation coming out of it, and really moving into the post-COVID era in a much better way, that where women really have a strong voice. I thought that was lovely.
Yes, and then last thing from Dorcas as well, with intergenerational leadership, like bringing the younger generation along with this as well. Yeah, especially when it comes to climate change, as that's the world being left for them. Thanks, everyone.
Great. Wow. Okay, great. So that's the two groups. So similar conversation in both groups. Similar themes being highlighted. That's really, really interesting. And I see Brida's just saying that INMO and members are key stakeholders. Brida, can you just spell out NMBI so we know what that is? Adrian, do you want to come in there?
Oh, no, I can go over our breakout group if you want.
Wonderful. Yes, please. Okay, great. You two are in the same group. Fabulous. Adrian, go ahead.
So we did have similar sort of conversation talking about navigating childcare options while working. Bridget mentioned a leadership program that she found very helpful in terms of work-life balance and redefining what success looks like as women, and kind of moving away from the portrayal of the male model of leadership, and understanding our value basically, and kind of leading younger women to understand their value. And then we talked about networking and kind of advocacy and addressing some of the systemic issues that we see. So.
Excellent. Okay, brilliant. I wonder if, Morgan, you were going to do, just to bring us to kind of make sure that we hear from everybody now that we've had those discussions, we heard from the panelists, we've had more discussions in our breakout rooms, and just to really capture everybody's voice. Can you take us through that Mentimeter again?
Sure. So yeah, just to, I suppose, these questions are to distill, I suppose, the discussion of over the last hour, and then the themes that were highlighted in the breakout rooms that Adrian presented. So if you go to www.menti.com again and enter the code 91997093, we're going to take you through 4 quick questions to get what was of most interest and relevance to you. So on your computer or your phone, and it should be in the chat again, www.menti.com and the code 91997093. So our first question, and again, no rush again, these questions we brought through, is which of the areas or themes presented by Women in Global Health Ireland is of most interest to you? So balancing life and career goals, the gender pay gap, workplace policies, leadership. So leadership definitely reflects, and keeping in mind that leadership, after what we discussed, it's feminist leadership, it's intergenerational leadership. Leadership in all areas, not just leadership in women's health, it's leadership in all areas of life are relevant to women. So leadership, hey, balancing life and career goals. That's great. Thanks, everyone. And then on to it. So which of the actions discussed is most relevant to you? So this is an open question. So of any actions that you suggested during the breakout rooms, anything that might have been suggested by another speaker, attendee, what was of most interest for you, for Women in Global Health Ireland to do over the next 6 to 12 months? What should we do to support our members and to advocate for gender equity in global health? Develop and support young women. Collaboration with other organizations. There was a few suggested: INMO, Nursing Midwifery Board, the Economics Group from Clare, acting in togetherness, linking with global international work, Women in Global Health Worldwide. We've heard from Malawi, Germany. Look at practical ways to influence Irish global health politics. Leadership gather models of good practice, bold leadership. It's a brilliant term. Linking local and global workers to reach towards greater equality for all in North and South. So definitely intergenerational aspect, collaboration, and how can we practically influence global health policy. Highlight common issues across countries and identify solutions applied. Fantastic. So I think we'll move on to the next question, which is how would you like to contribute to Women in Global Health Ireland? In what capacity would you like to work with, if at all, Women in Global Health Ireland? Or how would you like to interact with us? Paula, Adrian, come in there as well if I'm phrasing this incorrectly or not saying what we meant. Mentorship, collaboration in various countries. Lovely. Attending workshops, contributing to discussions, journal clubs. Mailing list of relevant events and research outputs. I think there'll be a little bit of crossover here between this question and our next. Research collaborations. Input to strategy. Fantastic. That's definitely during the meetings, bringing speakers from the South, seizing the time to amplify the COVID-19 local and global response. Collaboration workshops. And Joe, Nadine, if you think we might move on to our last question. I know we're a bit tight for time. And finally, what can we do to support you going forward? What matters to you and what can we do for you as part of the Women in Global Health Ireland membership? Would you like to be a member? What would that look like for you? What can we do for you? What kind of events? Networking, all the, what could, training and resources, research collaborations were already mentioned. Join us. I'm not sure if that's as well as referencing to meeting other groups where they are as well. Keep you informed, connect, support connections, be part of the strategy, capacity building, peer support, support network, networking and membership, networking, training, so capacity building. Brilliant. So really what I'm seeing, supporting and building connections between our members and other groups, training, capacity building, and keeping informed of what's going on in the global health space and gender equity space in Ireland and abroad. Brilliant. Thank you so much, everyone, for your contributions throughout the last hour and a half. I think that's the wrap up for the Menti.com. And then we'll be squirreling away to make sure that what we've discussed is represented in our strategy. Because that's, I think, really what we want, is to make sure that our strategy represents what women and anybody working in the global health space who feels like they haven't had a voice, haven't had a platform, they felt disenfranchised and marginalized, are represented in the work that we do. So Nadine, I don't know if I'm back to you or if we're closing up with.
Yeah, well, just to hear as we close, I'd just love to hear if there was one piece of advice from our speakers. We have Peggy, Alana, and Mwende. She's still with us as well, or is she? Yes, no, she's gone. Just from yourselves, what would your advice be to us? Just very brief to the chapter. Peggy.
I think just keep in contact with everybody here today. I think connections, and that was my word. I think that's just keep in contact with everyone and keep us informed. And I think that's, let's decide where we want to contribute. And I think everybody will, if they're given enough information moving forward and enough choice.
Wonderful. Thank you, Peggy. Mwende.
I think for me, I would say, being part of a movement is so voluntary, and it's because of one's passion. And me, I would say, is not to tire, because what happens in a movement is that we energize each other. So in your individual capacities, do not get tired of the cause, and you will keep on energizing each other.
Thank you, Mwende, and thank you for your passion and energy that you shared with us here today. Alana.
Yeah, I mean, really what's been said already, I would say just also to kind of have a sense of a common direction and what the work is, you know, I suppose helping to realize, because I think that really helps keep people involved and engaged. And I think being able to point to where there have been successes or where, you know, work has contributed to some kinds of positive impacts for individual women or in terms of systemic issues. I think, you know, that's people like to feel as though their work and their contribution is, you know, leading to that kind of change. So yeah.
Wonderful. Thank you. Thank you, Alana. And for all of us, you know, all of us here, Morgan, I'm going to hand over to you and ask you just to help us, you know, how can we stay connected? What can we do? And I know it's going to be, no matter what you say, it's going to be about getting involved and being active. And when we talk about women in global health, that is us, each and every one of us on the call. It's not them, that group there, it's actually us. So wonderful to just kind of look at this and say, okay, well, what could I do? What small thing could I do just to be part of this? So Morgan.
Very quickly, and I'm conscious, Dorcas, you have your hand up. Is something quick that you want to contribute?
Thank you. Just a very quick one to say, be bold, really bold, because the issues before us in the world require us to be bold. And be intentional, inclusive. I'd love to hear about nurses and midwives working in Ireland. What are their experiences? What about the refugee community who are making contributions in our lands? What are their experiences? So I wish you all the best. I look forward to keeping in contact with the community.
Thanks, Dorcas. So yeah, on that, please do join our membership list. I think it's been linked in the chat, because you're right, Dorcas, we don't just want to represent one type of woman working in global health. We're not just medics. We're from different backgrounds, for nurses, researchers. We want to represent everyone who identifies with this space. So join our membership list, follow us on Twitter. Our email is in the chat as well, I think, as well as evaluation list that the Irish Global Health Network is going to share if you'd like to give more feedback on this event. And we'll be following up with a strategy. We intend to share this by September. And if you have any thoughts beforehand, please do get in touch. And obviously, we'd love to hear your perspectives after we share this strategy. And keep an eye out for roles as well as this, and contact us if you're interested in working with women global health in the meantime. Thank you so much, everyone. And looking forward to, as Peggy said, connecting with you, full leadership, everything. It's so lovely to meet you all. Thanks very much.
Absolutely. Thanks,
Wonderful.
everybody.
And don't forget, everyone, if you want to watch this again, the recording will be on the website, so you can go again and watch it if you need to hear something back. We have an evaluation link. Would really help Women in Global Health Ireland to make sure that everything that we do is done well and that we learn from what we're doing. And just to thank all of the speakers and all of you for joining. So thank you, everybody. Have a wonderful, wonderful day.
Thanks for very much.
Thanks so much.